Dr. Anya and the Anaphylaxis Monster. Dr. Anya Sharma's heart beat as fast as the hospital's emergency room doors swung open. It was her first day. A patient was rushed in, gasping for air, their skin covered in angry, red welts. The senior doctor looked at her. "Severe allergic reaction," he said calmly. "Anya, what's our first move?" Anya's mind flashed to her textbooks. She pictured the enemy, the anaphylaxis monster. It was a chaotic beast, squeezing the patient's throat with its stridor tentacle and stomping on their blood pressure with its hypotension foot. She knew the first step. "Oxygen," she declared. A nurse immediately placed a mask over the patient's face. The monster roared, its wheezed tentacle tightening its grip. The senior doctor's voice cut through the noise. "We need our champion, the fastest hero in the ER." Anya didn't hesitate. She grabbed a syringe from the crash cart. "Prepare for Captain Adrenaline." With a swift, practiced motion, Anya administered the intramuscular injection. Whoosh! Captain Adrenaline, a figure crackling with pure energy, flew into the fight. He blasted the monster's constricting tentacles, his power immediately opening the airways. 0.5 milliliters of 1 to 1,000 solution, right into the vastus lateralis, he announced. The monster was stunned but not defeated. It began releasing its pesky histamine minions, tiny troublemakers that caused the skin to swell and itch. "The primary assault is blunted," said the senior doctor, "but its minions are still wreaking havoc. Call in the defensive line." Anya prepared the next medication. "Deploying the histamine blockers," she called out. A phalanx of stoic soldiers, representing chlorpheniramine, marched forward. They raised their shields, forming an impenetrable wall that intercepted the histamine minions before they could cause more chaos. The patient's breathing eased, but the battle wasn't over. The anaphylaxis monster had a nasty reputation for launching a delayed, second attack hours later. "We need to prevent a recurrence," the senior doctor advised. "It's time for the wise old general." Anya understood perfectly. She administered the next drug. General Hydrocortisone, a calm and commanding figure, arrived on the scene. He didn't fight with flashy speed, but with unshakable strategy, reducing the underlying inflammation and ensuring the monster couldn't regroup for another assault. The patient's blood pressure was still low from the monster's initial shock attack. "The patient is hypotensive from the fight." Anya noted, "We need the IV fluid brigade." A rapid infusion of crystalloid solution began to flow, replenishing the patient's system like a life-giving river. The patient was stable. The anaphylaxis monster was gone. Dr. Anya Sharma took a deep, steadying breath. She had faced her first great enemy, not with fear, but with knowledge. She knew the heroes of the ER, oxygen, adrenaline, antihistamines, and steroids would always be ready for the next battle.